Call to order and roll call.
So we have Arlene Zortman,
Here.
Tom DeBeat,
Yes.
Glenn Pepper,
Yes.
Carrie Snow,
Here.
Jenna Reed, and Jamie Davis.
Here.
Josh Rinaldi might be joining online later meeting. And then we have Molly O'Donnell,
Here.
Lauren Selly, here, Sarah Arney,
Here.
Brandy Queen,
Here.
and Leo Olivares.
Okay. Everybody get a chance to look at the minutes? If they did, I need a motion to approve and a second.
Shall I make the motion to approve?
Carrie and Glenn, okay. All in favor? Opposed? Minutes are approved. And now we will hear from all of the public invited to be heard. Okay. Organizational updates.
None today.
All right, we're just whipping right through here. Development and project updates.
Sure, so I'm gonna report on that real quick, and then I can't multitask that much, so Lauren, I'll send it in a minute. Something I wanted to report out to this group is, if you recall, when we did the Village on Main rehabilitation, we put solar panels on the roof. And originally that property had, all 72 units had individual meters, so every single ratepayer, which actually is LHA, because for senior properties we pay the utilities on behalf of the tenants, we had meter read charges for all 72. Plus, we put the solar panels on, and so we were, and this was a demonstration project with Longmont Power Communications for the intent of reducing the tenants' bills, but in fact, it's actually LHA, because LHA paid the bills on top of them, on behalf of them, I should say. So we are required to report to LPC each year what our annual savings are on energy costs because of the master meter that we installed instead of the individuals and those solar panels. And because LHA is realizing that benefit, because we pay the tenants' utilities, what we were able to do in lieu of paying those costs. So we've put together that memo to LPC, and I just wanted to report out that we had $16,000 worth of savings in the year due to the solar generation, and an additional $17,000 of savings because of not having to pay 72 meter read charges 12 months a year. And because of all those savings, we had budget available to upgrade the baseboard heaters, which is something we did not do during the rehab. And then it was right after we said, oh, they're functioning okay, let's value engineer, and then within a year those needed to be replaced. So luckily we had budget available to do that. So I just wanted to report out that I thought that was kind of cool that that is working. That whole pilot project, that it was a big experiment, is working out well. So that's one thing I wanted to mention. In terms of developments, right off the bat, and there might be more in this in the property updates, but I just wanted to report out that we did have a fire at Ascent. Has anybody heard about this yet?
No, but it was in the notes.
Yeah. So we'll get into more of the operations on that, but from the development side, I just wanted to say it was very unfortunate. It was sad. But we were very fortunate in that there was nobody home, nobody got hurt. The sprinkler systems worked like they were supposed to. It isolated the fire to the kitchen area. Because of the sprinklers going off, we had water damage all the way down to the ground because it was on the 3rd floor. But nobody had moved in below yet, so we didn't have residents really impacted. And then I'll save this for the operations team, but they're making arrangements for that tenant and those that were planning on moving in below. So generally from just the project side, super unfortunate, but also there was a couple things that worked really well, and also we still have our contractor on site. So while this was not part of their contract, obviously, they know the systems, they have all the materials, they know everything, so we were able to get them quickly working on a fix and work that through insurance. So I'll just pause there. Our grand opening is tentatively scheduled for March 3rd. Do we have this board on that invite? We don't have formal invites out yet, do we? Okay,
But
working on the
there is.
formal invite.
Yeah.
And you'll all be invited to that. And right now we do not expect the fire to change that because it's isolated to one stack of units. But we'll let you know if that changes.
It was in the kitchen
It's
of
in
one
the
unit
kitchen.
on the third floor.
Mhm.
What was the cause of that? Was it just?
Where the investigation report is to be picked up.
Yeah, so from what I understand from fire, Lauren and I kind of discussed this looking at the pictures. It looks like, or we were told that maybe some of the younger children that were moving in, maybe teenagers, threw some stuff on the stove. And it could have, and most likely, hit one of the knobs. And then it started burning, and then it basically made the microwave explode. So yeah, that's the preliminary thought on what I'm hearing.
So people were moving in, or?
Yeah, they literally
They
were
were living there?
moving in
that
Oh,
day.
gotcha. Ouch.
Yeah.
Oh, man.
So luckily they didn't have all of their stuff in yet.
Okay.
They did not have renter's insurance yet. But it did look like it was a limited number of boxes that were in and just got water damage.
Okay.
So it was tenant caused, not a failure of the.
Yes.
I think so, but the report will solidify that.
Otherwise, on development, we are working with a bunch of different groups at the city about, there's a lot of redevelopment proposals going on down in the First and Main Transit Station area. So we are working with them to see how housing could fit in and trying to get our next deal going. So by next month's meeting, we'll have some news to report there. I'm quite confident.
Can I ask a question? Do you know
Yeah.
what time the grand opening will be on March 3rd?
Yes.
Two.
Go ahead and see
So
if we
we're-
can get that on some calendars.
Yes, we're finalizing the invite list right now, so that should be going out soon. So Lauren, if you're still reviewing, will you make sure your services groups on there? Okay, I'll pause on development and project updates.
Okay. Items for input to the Board of Commissioners?
Yep.
None? Or Art?
Just a moment, I'm doing too many things at one time. Okay, good. All right, got it. I just want to make sure we were doing senior services first, so we are. So let me send this document so I can share it on screen. But Brandy Queen and Leo Olivares are here to report on our senior services data for the year 2025.
So the full year 2025 data is primarily on the first page and the top of the second page. And then there's a preview of coming attractions because we changed our case management system this year. We changed in May, which led to a little difficulty pulling data between two systems. The way that we're collecting data is a little different now. We're collecting more and kind of bigger picture data as far as what are the outcomes on cases, not just what are the needs that we're assisting people with, but what are the actual outcomes when we address those needs. So I additionally have pulled some reports on the next few pages that I'll explain that are only for May through December data because that is when we have our new system in place. So for the whole year on page 1, you can see both the first column has data for the LHA properties. The second column has non-LHA properties, so really the rest of older adults in Longmont that we're serving, and then total in the third. This is very consistent from year to year. If we look back at the last 3 years, the really big areas of need are the same. That the primary reason folks are accessing LEO services are for financial assistance. It does qualitatively look a little different for Leo's clients than for the rest of the community because his clients have housing and are stable there. Sometimes we are assisting with maintaining that housing. If folks have gotten into a financial pinch and need one-time rent assistance or deposit assistance. But really, Leo, do you want to talk about the kinds of things folks need financial assistance for?
Yeah, our, I guess, big three are assistance with hearing, vision, and dental. A lot of times folks, their insurance won't cover, let's say, hearing aids or dentures, eyeglasses, so they come to us and we can help them pay for that. One of my best stories this year was I had a lady at Village on Main that she fell outside, she face planted. She knocked out all her front teeth, and she didn't. Some folks just have basic Medicare and don't do anything else. And it's just like, so they don't have dental coverage and things like that. I tried to help her change that, because a lot of folks can go to Medicare Advantage plans and that helps them get more coverage, or Medicare supplements, those types of things. But I had the lady that fell and she didn't have any dental coverage. So she went to the dentist and they wanted $6,000 for her to get dentures. And I was able to, I used 5 different grant sources and we were able to get her dentures. She had out-of-pocket costs was $81, I think. So she was happy, so she's in the process now of getting it done.
Good.
Yeah. So just stuff like that, we're able to, our folks run the gamut. We have people that live off of $900 and something a month or less, and then some that might make $3,000 a month. So we, some of our folks have almost no disposable income. So anything that happens, vision-wise, dental, they just don't have the money to cover that. So I think that's the big thing. The very important thing is to help them out with that, because I was just telling her I have 2 financial cases I need to discuss with my team today. And then just different things. Sometimes folks might have, one example is a lot of our folks have vehicles and don't want to it's independence, they don't want to lose their vehicles. So they hang on, and then every now and then there might be an emergency repair and something broke down, they had to pay for it, and then next month they can't afford their rents. So we help out with that. We can help out with that. What else financially?
Well, you've had a couple of hoarding cases
Oh,
this
yeah.
year where we did a deep clean.
Yeah, there's some folks that it's to me it's a mental thing that they compensate. That's their way of compensating. I had a lady at Village on Main. She would, to me it looked like she would go to the thrift stores, buy stuff, put it in her apartment and just leave it in that box. And there are boxes and just a bunch of thrift stores. And another lady there was telling me that they have a table where they put free items out, and she would go over there and take everything and put it in her apartment. So we helped her with the clean out. It's really difficult because we've looked into helping them organize and things like that. But when you look at that, the clean out was $600, I believe, and they wanted $1,800 for the organizing. So we don't really have the funding to do that. So we have to work with folks like, a lot of times we get the clinicians involved. We have 3 clinicians, LHA does, where they can address the mental health aspect of it. But it's, we try to get folks like, okay, you have 2 weeks to downsize on your own, get rid of stuff, put all the stuff you want to keep over here and the stuff that can go over here. And it's basically, they're going to come and they're going to take all that stuff out. And what do they do?
They trash it.
Okay.
Yeah, the trash.
So it's a hard thing, you know, it's for people to let go of things, so we try, that's why we get the clinicians involved, because people, some folks have a hard time with it.
And sometimes it's not a true hoarding issue per se, but an ability issue where they used to be able to maintain and keep up their apartment, and they just have a lot of stuff and they can't physically stay on top of it anymore and keep it clean. And Leo can help them apply for long-term care Medicaid, which a lot of our residents qualify for, to do the maintenance, low-level housekeeping, just to stay on top of that. We're always looking in these cases, is there a sustainable way forward? We're not able to throw $4,000 at something that there is no path forward on. If it's just going to reoccur again, we don't have grants that are going to fund that. But if we can piece these things together, like somebody working with the clinicians, getting a deep clean, getting that ongoing assistance with Medicaid, that can be a sustainable plan. Some people still fail with that, but we're giving them that opportunity to maintain their housing. And that housing retention piece is why you'll see the next kind of highlighted, bolded section there is housing. Leo does a lot of housing retention with folks if there is really any reason why they're struggling to maintain their housing. It could be financial, it could be mental health, doesn't matter. We want to assist people in keeping their housing once we have gotten them into affordable housing. And then the third big need is health and medical. It really, we're all aging, we all have changes, we all have needs that come up, and Leo is able to help people figure out what are the resources to help address those medical needs as they change. At the top, I think, of the second page, we've got a total of contacts. So the data says Leo had 299 contacts with 156 individuals.
Mm-hmm.
What I'm going to say is that one of those numbers is probably too low and one of those numbers is probably too high because of our system change. I think Leo had more than 299 contacts, and we didn't catch them all in changing to the new system, training in the new system. And 156 individuals could be duplicating some folks between the two systems. We have one system now. For 2026 going forward, we'll have very clean data.
So Brandy, when you're talking contacts, if Leo is working with an individual and he meets with that individual 3 or 4 times, is that considered a contact, or is the individual a contact?
So each point of contact is a contact, with the
Okay.
caveat that if he sees somebody in the morning and then they call him and follow up in the afternoon or tomorrow, we usually put that in as one
The
contact.
same day, okay.
Even though it was technically multiple. It's like if it's within this 1 week on the same issue, we tend to just put in one note for our own sanity to keep our
Yeah.
system manageable.
And we're just better with the new system. We're using Salesforce now. It's just a better system where I'm able to, when I enter someone, I can go in there and check in progress. So then I'm able to, or you can close the case. If you know you're done, you're not gonna see them about this anymore, you close it. Or I could do in progress, like if I help someone apply for long-term care and I was like, hey, I need a bank statement, so I could send it to Boulder County. I know they're gonna come back, so we leave that in progress. So it's neat because I'm able to look at my open cases and just keep track of those, like, oh, I need to call so-and-so. So the system is a lot better.
We've actually never had the functionality before to see our own open cases.
Oh.
It was just a massive volume of human beings in the system, and we're putting in notes on them, and there was no opening and closing. There's no discrete case. Now we do have that. And when a case opens, we put in a case reason. So on page 2, you can see, and again, the rest of this data is just for May through December when we've had the Salesforce system. The reason people came in for cases, general information and resources. They're just looking to get some information and referrals that often they can move forward on their own. People who need help with their paperwork, like they've started a long-term care Medicaid application and they're not sure how to finish it on their own, Leo will assist them with that. The financial piece we've talked about. Caregiving, we keep track of how many caregivers we work with. Often at the properties they're taking care of a spouse. Homeless now is an interesting one because Leo technically rarely has clients who are homeless now. Sometimes they lose their housing and they become homeless now at the end of the case. Or they may have started a case with one of our other staff and they were homeless and then we got them housed and then Leah worked with them as well.
What's
So,
the definition of homeless in this case?
so for us, homeless is you don't have your own permanent housing. So you're living on someone's couch, you're living in your car, you're staying in a shelter, you're staying in a hotel, that you don't have housing of your own. All of these folks that end up at the properties, that when we are able to finally close their case, they're no longer homeless, right? We have gotten them housed. But some of them, their case is starting, they are homeless and they're coming out of homelessness.
Who supports Salesforce?
I'm sorry?
Salesforce, is that supported through the Salesforce itself?
The city actually has staff who do our Salesforce support. So we've still got some build and design hours with a company, Pacific Point, who built the modules for us. But then we've got city staff who are going to be our tech support moving it forward.
Yeah, we just had a retreat this past week, and we went over outcomes and everything, so we got better clarification on what we should be counting, and because I think across the whole group we were kind of shortchanging ourselves as far as me and my co-workers at the senior center, because the numbers were kind of, I look at some of this and I'm like, no, there's no way number at Hearthstone and Lodge should be this low, but it's I think Salesforce will change that, because just looking at some of these numbers, I've already done more than that this year.
So, yeah, on page 3, we've got a breakdown by property. So no building other is really the rest of the community. We've also got the suites in there because we do some work specifically at the suites too. Leo doesn't, our other staff do, including myself. But you can see how much he has been accessed, and these are contacts at the different properties. And like he's saying, Lodge and Fall River, they're hopping. We don't know why the numbers are so low for both of those. So part of our goal for this year is to be very consistent with our data entry, how we enter it, what we're checking when we enter it, and making sure, because we have to know that somebody lives in one of these buildings. That the system doesn't know unless we tell it, right? So for next year, we're thinking again, we're going to have much cleaner data. This last page is sort of a sample of what those outcomes look like. And if it is meaningful data to folks, we can do a deep dive on our data reports each year. We can do a whole report about caregiving and what those outcomes were. We can do a whole report about financial assistance and do a deeper dive, but this has a snapshot of the whole picture by property. For the cases that we were able to close, so cases that were not still open at the end of 2025, what were the outcomes?
So Suites is not on this list.
No, we did focus this one just on the LHA properties that Leo works at. We have that data though.
What's the general INR? What does the INR stand for?
Information and referral. So if somebody comes in and is like, Leo, I can't keep my car anymore, I need transportation options, help me figure out how do I get around Longmont. That is a general INR where he's giving them transportation
Giving them
resources.
information, right? Gotcha.
As opposed to helping them fill out an application, which we don't have to do for transportation resources, but for a lot of other things, or getting them actual financial assistance. So he might have a case where he's doing all 3 of those, and this will capture all of those outcomes.
Yeah, like my background, before I came here, I worked for Denver County for 20-something years. And last 13 were with homeless folks. So I know benefits and Social Security and all that. So a lot of the time I spend, some of the younger folks that aren't 62 yet, or when folks turn 62, I can help navigate the Social Security system if they want to do like early retirement, things like that. So that's kind of a general information, educating folks on how the system works, Medicare and all that stuff.
So we've got benefits and resource navigation as an outcome for a lot of our cases, that we are helping people figure out how to navigate those systems, which could be, it's a very high functioning person, we just tell them the phone number to call for Social Security and show them the website, and they got it. Or it might be a lower functioning person, really needs Leo to call Social Security with them, sit down, spend an hour or two navigating that process. And we meet people where they are. So if they need that little bit of assistance, great. If they need a higher level, he can do that.
But what would qualify then as a housing general INR? Is that just giving them information about available, affordable units that are out there?
Other
possibly?
options.
Okay.
Yeah, a lot of folks, not a lot, but folks, sometimes they want to move out of town or something. I mean, I just helped a lady Friday. She wants to move to Mariposa County, is that right? In Phoenix area.
Maricopa County.
She has family there, so I looked up a bunch of stuff on, the housing authority there and then a couple other places. That's the one thing I like about AI right now, the Super Bowl commercials. But when you Google something, it gives you a nice little script, and I like that, so part of it. And I gave her like 3 resources. I'm like, here, you need to start calling these, and especially the housing authority, because they're probably going to have a list. And so yeah, just stuff like that. If every now and then folks want to move closer to their family or things like that. Some folks have vouchers, housing choice vouchers, which is their voucher, so they can move anywhere in the United States basically. And later in life, folks want to be close to their families or just somewhere warmer maybe. That's why she wanted to go there. She said, I'm tired of the cold. It hasn't been very cold.
I think the housing INR sometimes also comes up around folks who really need a higher level of care and are willing to take a higher level of care. We need both of those things to be true. And Leo can help them find assisted living options or skilled nursing if they really need that level of care.
How many Leos do you have?
So we've
Just one?
We've got
For
one
LHA.
for LHA
Yeah,
for the 6 properties here:
Yeah.
Aspen Meadows, Fall River, Hearthstone Lodge, Spring Creek, Village on Main. And then we have 3 who serve the rest of the community. And sometimes I end up working on more complicated cases there too. Sometimes I end up working with some folks at the suites because their needs tend to be a little more complicated.
Feels like we should have 50 of Leos.
Oh, no.
You're like everyone's best friend.
No, just not everyone.
You help them.
Well, he has told me about how, like, as soon as he gets there in the morning, sometimes there's a line of people like, oh,
Yeah.
good, you're here. Because they have that quick access to him, which is really the beauty of Leo's position being at the properties.
Yeah.
They can walk in and grab him,
Yeah,
as
I was gonna
opposed
bring this
to
up.
waiting 2 weeks if you're out in the community
Yeah.
to see another resource specialist.
I was gonna bring this up later when we talk about C rate, but it seems to me, some of the discussions I've heard Quincy having here is that they're having trouble renting certain properties just because of the financials. But they're not gonna get these kind of services at a market rate,
Right.
apartment rate, so.
Not
how-
on site.
what- I'm sorry, what?
Not on site. They could go to the senior center and get the same services, but they can't get them in their neighborhood.
So it seems to me there's some value in that from a marketing standpoint.
Yeah,
That's true. It's faster access right now than generally going through the senior services because just due to capacity. That's why LHA pays specifically for Leo's position to have that quick and easy access. And,
So are we marketing that somehow as part of the benefit of
that's a great
paying the extra
point.
money?
I'll have to add it to the flyer I created.
Yeah, especially for the ones he's mentioning are senior units that are at higher AMI limits. Those are the tough ones. They don't line up with Social Security income.
Do
So.
we do any kind of public review? Like, remember when they were doing all the projects downtown, Carlton Street, and they had a couple of days when people, public could come in and just cruise through the room and see all the different projects and ask questions. Have we done anything like that with OHA?
Not on properties, but there is one, that annual city meeting is coming up April 22nd, and we're going to participate. It wouldn't be necessarily on-site at properties, just,
Well, I was
open
thinking
tours, but
on-site.
at least for marketing purposes, we're gonna participate, yeah.
And I will say, our resource specialists at the senior center who are helping people who are not currently in affordable housing apply to move
Yeah.
in are always telling people about Leo and helping people understand. You know,
That's the
you've
best kind of
worked with
marketing.
me in the community, but
It's free marketing.
once you get there, you've got a resource specialist on site. The only caveat there is if they're Spanish speaking, they still are working with our other resource specialists, and we try to get those connections made as quickly as possible.
And then Leah, do you keep normal office hours at each of the different properties then?
Yeah, we're gonna talk about Thursdays, I think. Thursday's my, floating day, but Monday, Tuesday, Wednesday, and Friday, I'm at a different property. And Thursday, every now and then I get people that, like, some of the younger folks, like, aren't retired yet. Cause we help folks 55 and up. So some of them are working and they go, I can't see you Wednesday, can I see you Thursday? So that's why we keep that open. And then we have paperwork to do and stuff, so there's always something, phone calls to return and just, but yeah, I try to do at the Hearthstone Lodge, Spring Creek Fall River, I'll do one in the morning and then one in the afternoon. That's how that works. And then I do Village on Main Monday mornings, but then we have a financial resource meeting that afternoon, and we go over cases as a team, like someone needs, rental assistance or whatever. Tuesday afternoons we have meetings, sometimes LHA meetings, so there's always something going on. I lose track of days. When you go to a different spot every day, you're just like, I'll be driving in sometime and I'm like, where am I going today?
Leah, on average, how long do you think you spend with each client?
Month-wise, for a month?
Just to throw any.
I mean,
any day that
it just depends on their need.
We've actually got a statistic on this in Salesforce. So on page 2, Salesforce is very powerful. There's a lot of data there. So there's a program called Power BI that they're getting me a license for, hopefully by the end of this month, where we can pull this data at any moment. And on that chart on page 2, you can see average duration in minutes. So on average, his appointments are lasting 52 minutes.
Sorry, I could have read your chart.
No. I didn't highlight that. There's a lot of data there. Like I said, we could drown you in data if you wanted that. I want to give you what's meaningful and helpful. But yeah, we can see on average about 52 minutes is what it takes to resolve a contact, right? That doesn't mean we're not going to have to meet again next week about the same thing. But for today, about 52 minutes.
So when you're looking at financial requests, do you prioritize them? So for instance, if somebody came with a car repair versus their teeth, do we prioritize? Or do they just whoever comes?
We don't do car repairs, and we don't help with medical bills, because it would wipe us out. Car repairs, like I said earlier, a lot of times folks that have an emergency and they pay it out of pocket, and then when they can't do their rent the following month, so we might help with that. That's how that works. Medical assistance, I mean, there's usually, like ambulance bills and things like that.
So we'll see, is there a basic need one of our grants cover that we can pay for so that you can pay for your ambulance bill?
And then we have other resources, like that one case I was telling you, that lady with the dentures that fell. I used AV Hunter, Friends of Man, and a Woman's Work, and then 2 of our grants to help her cover that $6,000. So there's money out there. It just those cases take longer because you're having to help them fill out applications for those places and.
Do you have
so-
any relationships with, like, say, some of the vocational schools where we could work some kind of deal with them to do car repairs for people who can't afford it.
That's a
It's
good
part of the
question.
training thing.
No, but we can look into that, thank you.
Yeah, and that's to me, in my opinion, those are the folks that struggle most, that try to keep their vehicles. A lot of them are paying car payment and auto insurance. And sometimes they're just struggle. I'm like, you might need to get rid of that car. And they just want to hold on to it because it's their independence,
The reason that got my attention, Leo, is 3 or 4 times a month in eviction court. That's exactly the story I hear. Well, I had to make a decision between getting my car so I could go to work or paying my rent. Chose to fix my car. Now they're 10 days from being homeless.
Yeah. And then you reach the point, you were mentioning the homeless now stuff. A lot of times is because folks are on such a tight budget, like might have a car or something. Some people have credit card debt, just all of it, and they're not paying their rent. Then they get behind, and then they've used all the rent sources in this area, and there are no more options, and they get evicted. And that's one of the examples of homeless now, is that they became homeless. We try our best to. They work well with people and trying to keep people housed. The property managers. It's rough out there getting senior housing usually, so especially if you're lower income.
I want to go back to Arlene's question about prioritizing financial requests. We have a grant committee meeting every week that Leo attends, where they review all financial requests for anybody who might meet the grant criteria. If we know right off the bat they're not going to meet criteria, we don't field it, we don't move it forward. But if they might, everybody gets quick grant review, so within a week typically.
So when you say not meeting criteria, one time at a meeting you said there are people that come to you and just they have the money to pay for it, but they choose not to. You don't give them. Are we
That's
seeing
correct.
that in LHA?
Sometimes, yes. Sometimes we have had residents who do have the money to pay their rent and they are refusing for a variety of reasons. And we cannot assist people who will not do their part to pay their own bills when they do have the money. So this is why we see people's bank statements. If you can pay $25 towards your dental care, we're gonna have you pay $25 towards your dental care. We might be getting grants for $4,000 more, but we always ask people to do their part. And we do have folks who, like I said, for a variety of reasons, we could talk half a day about that, just absolutely refuse to pay their rent, and we can't save them from that.
Right.
For every financial case, we go over their budget. So we sit down, okay, what's your income, what's your rent, what else are you paying for? And every now and then you go like, wait, you have $600 left over when you paid everything. And those are the times we might say, can we see a bank statement? See why you're not able to pay your rent or whatever. And they'll bring a bank statement in sometime and they're like, oh, they're going to Black Hawk or something, you know. I mean, it does happen. It's like, oh. So, yeah, we look at budgets, but most of our people, I mean, they don't have much disposable income, so that's why we help.
Okay.
Good questions, folks.
Anybody else? Okay. That was very informative. Thank you.
Thank you so much, Brandy and
Need
you.
more Leos.
Yeah. I would say that, the lack of resources out there for supportive services there's lots of different kinds and levels, but there really is a lack of resources out there for that. So LHA pays for Leo so that our residents have that opportunity. The city and LHA are also partnering on the clinicians model, which is providing clinical support services. There's lots of various levels you could go into. Case management, clinical case management, but that is something that, because there is no resource out there to pay for that, the city and LHA have jointly made that commitment to this is important. We can see in the data why it's important, and we're going to do it. So that's something I'm always really proud of, and you don't get that everywhere. And also, it would be really great if the state and the county would come up with some resources for that, but for the meantime, we're making it work with what we have.
And like I said, I came from Denver, and Boulder County and this community does a lot more for their seniors than Denver does. Just so keep up the good work.
Denver probably has more money.
Thank you.
All right.
And you can stay, you can go, whichever.
Got another meeting.
Thank you.
Thank you.
You're welcome.
So I realized, Arlene, that I wanted them to be able to go first. So they're under resident quality of life, but then I just put everything else under the same category. That was inadvertent, but I still wanted them to be able to go first. So the other two items are actually supposed to be under input for LHA Board of Commissioners, but we're
So then can I have a question about something, and I think it might
Sure.
go under resident quality of life. And this has come up at several different facilities, and that's that little pocket of money that we give them each year for them to do their parties or their meetings or, you know, that kind of a thing. Do you know, are they going to do that again? Are we giving them? It's
So-
been like 2,000, 2,500, something like that.
That's part of our property budget. So it's part of the property's budget. It's set aside for resident services each year. And there is a bucket that they pull from if they want stuff, you know, new patio furniture, different seat cushions on their seats and outside, for their birthday parties that they host. All of that money comes out of that. It used to be where they were given a pot of literally the money
Right.
that they spent and committees were formed. And they got rid of that because it became a popularity contest. And people were not getting what they wanted because they weren't popular.
So then it sounds like we're not communicating this to the place.
Oh, yes.
Okay,
We've
because
talked about this every
Okay.
year. They've asked.
they're still asking. That's why I kind of find it kind of strange.
The money's there. It's part of the budget every year. We've gone over that when we do our coffee and conversations where we talk about property budgets. We do talk about it. It comes up every year. That's part of the property budget, so it gets allocated every year. Sometimes it gets increased. It was depleted very quickly when we were doing monthly coffee and conversations.
Oh, yeah.
So now there's actually more money because we're doing it quarterly. So if there's things that the residents want for resident quality of life, they can go to the property manager and ask them for that.
Okay.
And that money comes out of there.
Okay.
Yeah, it's still part of the process. They just, I don't know why it might be new residents who are asking.
No,
or
it's not.
The same.
So they don't have any idea of how much they can spend. So if they came to you with a big request, that would take quite a bit of it for the year, right?
Yeah, and they would go
So-
to the property manager.
Okay.
Yeah.
Well, by you, I meant LHA.
Yeah.
Okay. So then the property manager could say to them, you want this big piece of equipment or whatever it is, your budget now is going to be that much less. And now you have $50 left or something like that.
Well, and it
Can
depends
they-
on what it is. If they're looking
Yeah.
for an upgraded elliptical, like because the elliptical in their fitness room is not working, that might come out of a different bucket.
Right.
It's not going to come out of their bucket.
Right.
But if they want to do new decor in a gathering room, or they want to add something somewhere, I'm thinking like Aspen Meadows, I think they requested to have new umbrellas on the second floor patio. That would come out of their, those kinds of requests.
Okay. Okay.
But yeah, that money is still there.
Okay.
I think some of them want it to be back in their hands and
They
control,
do.
but that's not going to happen.
They do, and yeah, and I think they
That's
just
probably
kind of
why
want
they
to see
keep
that
asking.
little, how much is there, and, but yeah. So it's really kind of for their parties or whatever they want to.
Yeah, and it
Thanksgiving, Christmas, Valentine's Day,
they use
whatever.
the most of it around the holidays
Mhm.
to pay for catering.
Mhm.
Yeah, John's always really good about making sure they have their turkey and ham.
Oh, he's good about that.
Yeah.
Okay.
Is that calendar year too? What is it based on?
Yep.
So I think Molly, you said that, and Arlene, I don't want to take the going through the itinerary from you, but are you going to address the developments, if there are any, with the early childhood development center and our center? Because I think we did that last time under
Yes, we did an update.
items for input. Okay.
Yes, So,
I selfishly want to hear that, and I have to run out to get a fixed root canal in a minute, so I just
Oh,
really
yeah,
wanted
sure.
us to get to that, sorry.
yeah, so, we did report that out at the January meeting to the board. Our center's
Right.
board has approved moving forward
Great.
to be the partner that
great.
provides the services on site. They're doing, it was a kind of a conditional, as long as the kitchen helps serve their needs to serve both of their properties, so the Aspen Center and the Ascent ECE, which we're confident that will be worked through just fine. So Katie Pung is working that through with they're working through licensing and the city on inspections and that type of thing to make sure the kitchen is going to meet their needs, because that is one of the benefits for them, because it's a big enough kitchen that they could cook the food for both of their places, because I know that they've struggled with the kitchen over here. So all things are looking like a go. We also did get financial commitments to help on the first year of operations from our development partner Penrose, and we're working through the foundation arms of our tax credit investor RBC, and there's one more, maybe it was Danuve, our general contractor. Anyways, we're working to help them gather up resources too to get over the hump of that first year operations costs. So everything is looking good.
That's fantastic.
The
And
infant
there's-
room is still a no-go, right?
The infant room is still a no-go for now.
Yeah,
For
for now.
So, it's looking for the bright side. We're
Yeah.
still able to serve income qualified care
Realistic.
and hopefully grow. I feel like that's the theme of affordable housing and a lot of different stories right now is we're at least getting a foot in the door with the hope to expand later.
Baby steps.
Okay. Did that answer your question?
It did.
Okay.
Thank you.
All right.
All right.
Moving on.
I'm circling back on the Parkside and Mountain View revised special limited partnership proposal. So we talked about this a little bit, I believe it was last month. We've been negotiating with that development team for the past month. I was gonna tap in Tom, but I think we got our questions answered from their side in terms of, it's a very unique deal setup, but I think we did answer the end question of your cash flowing. Do you need this? And the answer is yes, because their cash flow, it's very unique, and I could get really in the weeds here, but they bought the land in advance, so they're excluding the land from the deal, so above the line, so they're leasing the land back to themselves so that they didn't have to fill a gap up top, they're filling it with their own cash flows down below, so they're self-financing their gap. A little bit funny. I might send it to you anyway. But it was just a unique deal. So what we're doing as of this afternoon even, we're still negotiating with them what a special limited partnership fee could look like, something that we would support taking to the board next Tuesday. So I'm not going to share it all right now because we're still in negotiations. But it looks like there will be a proposal brought to the board next week. And it would be something that gives LHA a nice general fund boost and also serves the project so that they can pay bills, and also because it's an existing property, this is why this one is so unique and how we're looking at it. It's already an existing property on the tax rolls. It's not a new build. And so trying to make sure, knowing that everyone that receives tax revenues is super strapped right now with, and taking a hit would be a challenge for some. So we're working through all that with them, and we do plan to propose on Tuesday a deal. So Tom, I might send you a summary after this of what we're looking at. But I think we made it over the hump of trying to decipher what the deal setup is. So I shouldn't say much more. I just want to let you know it is coming, and the negotiations going up to the wire. So I don't have them ready for today.
And the whole goal is for them to be exempt from property tax?
That is their desire.
Yeah, that's the end goal, right?
Mhm.
Right.
Yeah. Okay. Is there any questions? I will try and answer my best, knowing we're in the middle of negotiations. Okay.
So this is kind of a dumb question, but anyway, if they're going to want to be exempt from property taxes, that means they would never pay property taxes forever, right?
Until the partnership ends, which usually in a tax credit deal is about 15 years. And they can then request it again if they resyndicate the tax credits, but they would have to do that again in a 15-year cycle. So, we do have all of the information on what their tax liability is today. And then the big problem for the deal is that the tax liability would increase with the improved value of the properties after the renovation. And that is what is a real struggle for an affordable property. So, working through it. Trying to strike a balance, that's the goal. Strike a balance, get some benefit for everyone, and in the end, ensure that these properties stay affordable, so. Okay.
Okay.
You ready for me to move on?
Mm-hmm.
All right. Our 2025 progress on LHA goals. I have to tell, well, that's unreadable. I will zoom in if we're gonna focus on anything specifically. What I wanna say specifically is, these were created in early 2022, and this really was more of a rescue plan for LHA. This is not a real strategic planning effort. It was, what problems do we see and what do we think we need to do to solve problems and also make LHA sustainable for the long term and improve resident lives. So this was put into, it's a spreadsheet, because in 2022, we did not have resources for a real big, nice, beautiful strategic planning effort. And it was really just more of a tracker for the Board of Commissioners of where we are with each of these major elements that they found. So there is honestly not a lot to report this year, because many of these goals we have exceeded already, either a year or 2 years ago. And then some of them are really, the ones that are still in progress, I'd say, are about service provision partnerships and connecting our residents to the community. And I think there's always work we can do there. And I do think the lift on staff of getting LHA's development, financial, resident culture, all of those other key elements has usurped the last 4 years. So I think that there's always room for growth there. And what I really want to say is I feel like we've tapped out these goals. I do plan on reporting to them, to the Board of Commissioners, especially since some of the commissioners are new. But really want to use this as a jumping off point to encourage the board to do a true strategic plan effort in 2026 and set some organization-wide goals that can live beyond 4 years. And so that is going to really be the impetus of the conversation next Tuesday night is, here's what we said we needed to do for the next 5 years. Here's what we've done. I think it's time to sit down and do a true effort for that's not a 5-year plan. That's a, longer than that plan. So I don't, unless somebody has a very specific question, I didn't plan on going through each of these. There is really a lot of it is refer to prior year. We accomplished this and we're just maintaining. So let me know if you have any specific things you would like to dive into deeper.
So the formal survey for 2026, is that still planned?
So,
if so, when are we planning on doing it?
I would
How?
say no, it has not been specifically planned.
Okay.
What I would say is the focus on, and Lauren can speak for herself here, but really in the last 2 years since we were able to hire Lauren's position is getting our operations stable with good policies, procedures, ways to improve, getting out of survival mode and into thriving mode. So I think at this point, in the first couple of years, we did a ton of resident work through the appreciative inquiry interviews that we did and report out to build resident trust. And really just, that was not having resident trust and having residents that could flare caused a lot of staff time and resources. And I think for the first 2 years, we really got that to a happy, stable place. And then the last 2 years have been focusing on, okay, we have that. Now we can focus on the staff on the operations side and really get them integrated into all of this, having those tools to rely on. So it feels like now we're ready to put it all together. And if we were going to go back and do more resident surveys, that is something that we could do in the future. So we haven't yet talked about what that looks like. What do we really want? And is that what we really need still? Or do we need something different still? And maybe that's the conversation. But that is something we had planned to do from the beginning and I think because a lot of the things that are still either in maintenance mode or kind of outstanding, it's all around those service models and partnerships that that could still be a useful tool to have, is asking residents what services they really need to help feed into what do we do with our service models in the future. A lot of it we're getting kind of ad hoc. So we have the senior services data report out. We know what people are talking to them about, and that's a big portion of our population. So we kind of have the bits and pieces, but it hasn't been this big holistic survey effort. So,
well, I mean, what's the end goal? What do we want to get out of this survey? What's the purpose of it? I mean, if it's just figure out the services that we need, and we have, say, 85% of our coverage already done through senior services,
we might.
Is it necessary to even do it?
I think that's worth
or just focus
discussing.
on the non-senior
right
as well,
right.
and wait for Ascent. Maybe it's not a good idea to do it yet.
Yeah.
Maybe let Ascent be there for a year and then maybe do a survey for 2 years. Yeah.
I think that
for the non-senior
is very worthwhile thing to consider. Like we don't need to do it if we don't.
If we're not going to
have the answer.
Well, what's the value?
What's the value?
Yeah. Why waste time?
Yep.
Yeah.
And we have there was a lot of really specific proposals in there around True Pace and Cultivate and very specific organizations to look into. And we do work with Cultivate. We've got some things continuing, but then in terms of really solidifying supportive services structure in that way, I think it's worth the conversation. Reanalyzing what do we actually need, and are we going to do a survey, and are we going to get the answers that are going to help us actually do something anyway? I think it's worth revisiting. I put it in there as we can do this in 2026 if that's what the board wants us to do, but I think that there's worthwhile conversation around the value for sure.
Well, and you also mentioned the 15-year compliance period, but then here CHAFAs are required 20 years.
Yeah.
Is that what we have to lean towards now as
yeah.
a go forward basis?
So when we created these, we knew we're watching for 15 years, and then after going through AMSA and Village on Main, we're like, that's not going to happen. Right. So it's pushing out the timelines on some of these. So again, I feel like this is a point in time needs assessment, and some of the needs have morphed, and I think that's worth transferring into a strategic plan that can be more living and breathing and morph with the times rather than being so specific to a certain date.
Right. So then does that then push out development fee schedules then to be more realistic, to be more?
It does for those, but we've also made so much progress that we are ahead of where we envisioned being in 2022.
Correct.
But that does push out some developer fees, yeah.
Right.
So this is more of a kind of, we've done it. We've done it. This is what you were looking at 4 years ago. Now what do we do? It's time to figure something else out. So.
Yeah, there's a lot on here. Yeah.
Yes, and a lot is very specific. Some of it tracks from, it's refers to above because everything's so interconnected. It's a spreadsheet is not the best way to do this for the future.
Well, I mean, and there's areas that we're lacking. I think. I mean, we mentioned in here that we want to prepare our voucher holders to maybe move out and get something on their own, but we also need to have something internally, like tracking our own voucher system and providing additional vouchers for individuals in the future. What was the other one I was thinking too? Oh, with Yardi, is there any other stuff that we can add to Yardi to make it more robust and different phases that we can add to just to help?
I think
our
the
residents
amount
as well?
of Yardi upgrades and implementation we've done was not even anticipated in this document in
Exactly.
2022.
Yeah.
We've done a lot more
Right.
that's not even shown here.
Right.
And I have requests for like contracting and like contract buy down,
Mhm.
because we don't have a contract process. So it's kind of wild, wild west, making sure contracts line
approvals
up
on
with
that,
invoices.
awesome.
So,
So we're using Yardi. Do you want to do a little recap of what we've done in Yardi so far?
yeah, so late last year, we rolled out online applications for the affordable side. We had already rolled out online applications and recertification process for the voucher teams, because the voucher side and affordable are two different modules within Yardi. It was not easy for people, you know, getting into, we didn't do a lot of testing ahead of time. So we kind of went into it knowing it was going to be a little clunky. I think the biggest issue with Yardi, with online applications, is that if somebody has a previous Yardi account, they account from another place where they rented, they have to merge the two, and that can be tricky, especially if they're like, yeah, I had a Yardi account, but I don't remember where, I don't know how to log into it. So we worked through a lot of those issues. We rolled that out. It's been going well. We're pushing as many people as we can to use the online process, recognizing that some people just, it's not for them. So we still will work with people with paper if absolutely necessary. The other next step that we have is signing leases within Yardi. We're still working through that process with the Yardi teams to get those leases embedded into our system, where they will just click through and sign. So it'll all be 100% paperless. The next rollout after that will be mobile maintenance, with our teams using mobile maintenance on their phones and internally within Yardi to track all of our work orders, and having residents be able to log in and submit work orders online through Yardi without having to do paper. We'll still have paper available, but we will encourage people to use the online system because it'll be so much faster and it'll track everything.
We'll track it.
Yeah.
So currently it's all still done by paper?
Yes.
Okay.
Yeah.
We're also hoping to maybe start
Bring in
backgrounds
background checks.
through Yardi. We're
great.
digging into that.
Yeah. And then Kendra's, it's on her list of my dreams to have the contract process all brought into Yardi, so that whether it's being signed in Yardi or just routed and tracked, where you would buy down against a contract, kind of like Oracle or some of the other systems that other organizations use. Because right now it's just a very manual process. We pay everything out of Yardi, out of, I think it's called Elevate. But our contracts are just living somewhere on a drive, and that's not the best. And then I'm sure there's more stuff, more modules and add-ons and plugins. I think there's Salesforce has some tie into Yardi potentially in the future, so that we can make sure that our clients are, getting included in the city tracking of who qualifies for services, so that they only have to qualify one time and not various steps. So, but those all take time.
Is there additional costs, I'm assuming, with all those additional modules as well too?
Yeah. I do believe that we had a lot of modules paid for when LHA first moved into Yardi, but didn't use any of it.
Gotcha.
And then we increased that above and beyond what they had originally.
And now is that a set, like, subscription fee, annual fee? Okay.
Yeah, per property.
Oh, so when we add new properties, our fee goes up as well?
Yes. It's like when we added Zinnia.
Yeah, right.
That increased fees.
Right.
Now it's that increasing fees. So as the units, our total portfolio goes up, our costs go up.
So part of the change was to have people pay their rent online.
that
How is
also.
that going?
I think a lot of tenants are taking advantage of that. It requires a little help setting up for some, but I would say a good chunk of people are paying online, and it's automatic. So the forgetting to pay your rent, it will happen a lot less frequently for some. It's just a safer option. I've known of people who have claimed to have, slipped their check underneath the door when nobody was there, and then it goes missing, and we can't. We're like, I'm sorry, but we have no way to prove that if they don't use the rent drop box. So I think for the people who don't like doing that, this is the best option. We have a lot of people, even at the Suites in Zinnia, who want automatic payments because they want it to come out so they don't have to think about it. Same thing with seniors. So it's been well received, and I imagine with Ascent it'll be heavily utilized.
Good, because that was one of the things that was on that way back interviews.
Any other questions? If not, I'll report back what the board thinks about potentially a retreat and future strategic plan process, or goal setting at minimum.
So I cut this out of the newspaper and figured that you would have some answers here. So Polis unveiled 3 new housing bills. Are you aware of them, and how are they going to affect LHA, or are they going to affect LHA?
So which ones is that referring to? I've been tracking like 12.
Okay.
There's
So
many.
House Bill 1066 exempt vacant land.
So that one would certainly improve timing on entitlements for affordable properties. So this one is basically, as a city gets an entitlement application for affordable housing, when it's proposed by a nonprofit on church land and some other details, then it basically gets fast-tracked through entitlements. On the pure housing side, that certainly could speed up some projects. Some of them would already be that fast because lots of it is infill. However, so that's on the, if you're purely coming from housing perspective. But what that one really touches on is home rule, and can a state preempt a city's local planning process? So that's where that one gets touchy and political. And overall, all of the ones that have come out that are state preemption of local planning that have been frequent in the past few years, some have passed, some haven't. Generally, Longmont's already doing all of the stuff that they're requesting. It's really targeting communities that are opposed to housing. And so what it ends up doing is kind of punishing the communities that are pro-housing in order to require communities that have not been pro-housing to change. So that is a tough one when you come, now we're talking on the city side, that's a tough one for council, because there can be unintended consequences. There certainly can, of breezing through a development without looking at certain things. It could be a myriad of things. So my analysis said it would benefit housing. Longmont's probably already doing the things that this bill is looking to have communities do, and it could hamstring the city from making decisions about what goes into its neighborhoods. Not in terms of affordable housing, more on setbacks and neighborhood character and things like that. So that's a tough one.
So 1001, it's going to allow nonprofit groups to largely go without local government approval.
Oops, that's the one I was talking about.
Okay.
Hang on, let me pull up my
Because
tracker.
1066 is...
Isn't that the transit one? Hang on, I've got a list.
No, it's property taxes. The subsidized rental units from being subject to a property tax. Exempt vacant land.
Oh, I see.
Yeah.
Okay, sorry. I was talking about 1001, thinking about nonprofits off the bat. So that one I have yet to dig into, but right now, housing authorities have statutory authority to extend property tax credits. A 501c3 nonprofit, gosh, this gets technical. They're exempt from certain taxes, but not all taxes. So I have to do the analysis on that one still, but I think that would generally be favorable for affordable housing. I think it's trying to expand their tax exemption without having to rely on a housing authority to extend it to them.
I think they're just exempt from sales tax, is all for nonprofits.
Okay,
Currently.
so that would allow them statutorily to get a property tax exemption without requesting a partnership from a housing authority.
So I guess my question was, if we're talking about the land strictly being exempted, or is it also the property that's on the land?
It would be the entire improved
The entire
value.
thing,
Yeah.
okay.
So for example, when In Between came to the housing authority to request that property tax exemption partnership, that's because they couldn't get the property taxes waived on their side. So then they wouldn't have to come to us. They could just do it themselves.
And that's for new developments, though, right? For this, for the property tax exemption?
I haven't dug in enough yet to see what it specifies. If it's new
Yeah,
versus.
it doesn't actually say new, it just says
Or development.
would exempt vacant land. Yeah.
Well, vacant land, that implies new.
Yeah, that's why I
There's
was wondering if it
nuance
was
there
just
we'd
land
have to dig
strictly or-
into. I'm not sure about that part yet.
Yeah. And then Bill 1065 would set up 2 financial programs for which local officials and developers could apply. One would use sales tax revenue, and this is the one that has the transportation thing.
Transit and housing investment zones. This one is on my list to go through. This might be the one that the city authorities have made a bill of support for, from just generally, they already knew that this was going to be really important in Longmont with our transit-oriented design going on down there.
Yeah.
So I haven't dug into this one yet.
Okay. Are there any
Because there's
other?
a couple, I don't want to speak to it because there's a couple transit-oriented ones and I don't want to mix them up.
So are there any other bills that would affect the housing authority that you are really concerned about?
There's one that we did a pretty in-depth analysis.
Talk about that one?
Sure, and I think in the end, we already provided information to city council on that. And really it's like, it could be good in some ways, it could be impactful to operations in some other ways. In the end, it's kind of like, we could do it, but let's see how it goes.
So it's another bill for tenant, under the guise of tenant protection. One is the requirement to attach the lease, the rent ledger, and evidence to notices and complaints before you file an eviction. Right now, the lease and the rent ledger is required by our attorney anyway, so we're already doing that. Evidence of notices and complaints, that is a little tricky for us because sometimes our complaints, we try to keep them anonymous. If neighbors are complaining about a tenant, they're less likely to come forward if they know that their written complaints with their name on it are going to be handed over to a court, a public court. So, and then the neighbor will know it was them, ratting them out. So I'm worried about fear and intimidation and people not wanting to come forward and give us the requirement that we need in order to file some of these demands. The other one was redacting PII in notices. We don't personally put, public, like their personal and private information in demands to the extent we can avoid that. We don't put that in there. So that really doesn't change anything for us. It's just more privacy for the tenant. So none of their, identifying information would be included other than their name, which is public information anyway. This is the big one, suppression of eviction records, with the exception of substantial lease violations. The language of the bill, it's unclear what would constitute a substantial lease violation. They cite a different statute that talks about substantial lease violations, but I think it would be beneficial for them to revise that to be really strict on if they're going to move forward with this language, what constitutes a substantial lease violation. Because what they're essentially doing, the con for us as a landlord, is it would suppress evictions based on non-payment of rent or consistent, non-substantial issues. So if you have a tenant with a long history of being, you know, a problem, but it never rose to a felony level, which would get you a substantial demand, but it was continuous and pervasive, you wouldn't know about it because it would be suppressed. So when you do your rental screening, it's not going to show. If they were evicted for non-payment of rent, it's not going to show. So it's actually going to push our smaller landlords out. They're not going to want to deal with this. So worried about that, which is going to put more pressure on us as a housing authority and housing provider. If landlords get risk averse, you know, we might inherit tenants with behavioral and payment issues that we can't, and it's going to require changes in our tenant selection plan. You know,
So you wouldn't actually be able to see if they ever had an eviction.
What's the substantial?
Only for substantial
only for
violations.
substantial
Well, then-
violations,
then
which is
you-
unclear of what would constitute a substantial
So
violation.
Then you're doing it old school. You're still having to call the previous landlord
And it's
ask
more
them.
like an under the table, you know.
On top rating, I would kind of now anyway. I mean, most of the stuff that comes through eviction courts, it suppresses the records or they vacate the record if the client does certain things.
So it's pretty clear what it's attempting to do. In some cases, if somebody did get evicted for non-payment of rent and they were in a limited period of time that was tough and everything in the economy is terrible, but they don't have, there's not a pervasive pattern, then it's trying to protect those tenants from struggling to obtain housing later. But the unintended consequences are there's this whole reaction that could occur that may just not help the situation anyway.
Is there anything in the law that prohibits you from asking about their eviction history?
No, you can ask, but if it's suppressed, they have the right to deny that they were ever evicted.
So that's not considered lying on there?
Correct.
That's interesting you say that because the judge told me something opposite.
Based on this bill?
No.
This is all based on the bill. They can
So
deny.
the bill now says that they can deny it. That is a significant change.
Yeah.
We've told people for a long time that if it's suppressed and not vacated, you've been evicted, and you have to, technically you have to say yes.
Yeah. This kind of reads as they don't have to disclose it because there's no way for us to find out unless we call the landlord, and even then, I don't think we can use that against them.
You couldn't use them? You couldn't use that against them in an application? If they found out, like, they didn't pay their rent, and I could say, I'm not renting
That's what
to
will
you.
get argued in court. I mean, that's the risk is that, if you're the one, the first landlord to find out that someone got evicted for something and then you deny them housing and you get sued.
What's the bill number?
HB 261047.
Do that again, 26?
HB 261047.
The other requirement in this bill was a non-electric fee-free rent payment option. So if you're moving to eviction for non-payment of rent, you have to give them an option to pay, whether a payment plan or an ability to pay that doesn't involve it being online and doesn't involve a fee, which we already do. So that one doesn't affect us.
Meaning they could pay it with
A
cash or
personal check.
money?
Yeah. You can't force them to pay through Rent Cafe and incur a fee. I'm guessing a lot of private, larger market rate households have to do that, not us. So that one doesn't affect us.
But it doesn't say specifically that you can't deny them for payment history.
Yeah.
I can't imagine a world where you couldn't deny someone for payment history. That's
I have the same argument that they were making.
I mean, that's crazy. That's like lunacy to me. It's why all of our properties are currently under contract.
Are they?
It's kind of like the same
Yeah.
with the law last
To a
time
rate.
where they
It'll suck.
said you can't deny somebody roll of release if they've been there longer than 12 months.
Yeah.
I think generally this is like the third or fourth year where we've just had all of this, landlord-tenant relationship stuff just rewritten and tweaked and gone back and forth and it's just dizzying. And obviously, our concern is, there has to be a balance. We do want tenant protections so that people aren't unnecessarily getting unhoused. we also cannot lose our landlords, or else there is nowhere to house it anyway. So how do you strike that balance?
The other thing that was important in the first one about, providing evidence of notices and complaints is that your failure to do so as a landlord is an affirmative defense for the tenant, which means it's over and you have to start over again and file all over
Your
again.
failure to do,
To include the required documentation.
which is the lease.
The lease,
Which
the ledger.
It has to be a rent ledger too?
It has to be a rent ledger, and then evidence to notices and complaints. So you
So if
can't
you're
just turn in
evicted
the
for something other than.
non-payment. Yeah, you've got to submit all the evidence that you have
To the court.
to the court when
I mean,
you
that
file.
happens now.
We don't
You
usually, no, we just give the rent demand, which we cite to, incident reports, and we put as much information in the rent demand. But if this passes the way it's written, you'll have to submit all of that documentation as backup. And if you fail to do that, that is an affirmative defense and the case does not go forward. You have to start all over again. So one of the recommendations that I made was give landlords an option to cure, 2 weeks to cure, because then you're just gonna be wasting the court's
Right.
time.
You're just gonna be coming back over
Yeah.
and over and over. One of the things I just I don't know if you guys looked at your 10-day demands recently, but I just got mine kicked back. And it was the one the lawyer had given me, and she's like, nope, and now it has
Changes
trouble.
every month.
So maybe you wanna refresh that, because I just got one kicked back and I have to start over, so.
We are currently operating under one headed to court Friday, so I'll check in with Christy.
Good luck with that.
Yeah. I'll check with Chris. She's usually on top of it.
Is
already.
that
well,
just a return hearing?
Hmm?
Is that just a return hearing?
It's the first one.
Yeah, because the way Boulder County works now, there's no judge that looks at it. When it comes to that, on Friday, no judge will see it. And there'll be a discussion between the mediator or the attorney for Bristol Justice or Ball City of Boulder, depending on which it is, and then the landlord's attorney. And if they reach an agreement, then it gets documented and the step goes into the file, and eventually the judge will see it. The judges are there anymore. We don't even see a judge anymore. Unless they,
There will
unless
be
they,
no stipulation.
So I had the same law
AI
firm
judge.
to use,
Yeah.
and
AI
I still got
judge.
it kicked.
Okay.
So now she's redone her.
Talk about job security,
No.
tenant, landlord law.
Yeah.
So I did want to say there's a whole other list of ones that I still have on my list to do the analysis for. There is affordable home ownership program, so that usually is looking something like some sort of funding program that's coming out. So I'll see what that one's about. Colorado Housing Finance Authority mortgage post officers first responders. No idea based on the title what that one means so far. There is one coming up. SB 26054, security deposits and post-closing occupancy agreements. So we're going to have to dig into that one. That one's coming too.
It's 054.
SB 26054.
I read one about a security deposit return, and it's basically you have to give it back. What is it?
What is that changing? I wonder.
All of it. It doesn't matter. It doesn't matter what they do or what damage they created. Like you're just better off giving it back and eating the loss, honestly.
Okay, maybe I'll put that one on the top of the list.
Yeah.
Okay.
Okay. All right.
who's pushing all these bills?
I know that the first few I reviewed have come from the same set of representatives. These were House bills. I'll just pull up and see what the example one is. Like HB 26101. This is the. No, that's not the one I was thinking of. I'm going to pull up the one that's doing the tenant one we were just talking about. 1047. Sponsored by. Oh, just one person, Joseph. House sponsorship, no Senate sponsorship, and I don't know why there's not a full name on this. I've certainly seen that there's been a pairing of sponsors on several of these. Sirota and Mabry in the House, Cutter and Weissman in the Senate. Sometimes when you only see one sponsor like that, specifically on the one we were just digging into. I don't know, we'll see how that goes. It's not a big committee. So, anyway, I'm just projecting.
Okay. All right, moving right along. LHA property update on operations.
Okay.
Or occupancy report, however you want to do it.
So we're looking at changing this report. I know we've been saying that for 2 years. I love this report. But hopefully we'll be bringing a different report in the near future as we start kind of digging into the things that Yardi can offer. I have a couple reports after this one that we're going to start using. So you'll see we had some reductions in vacancy at some of our properties, increases in others. We have had a lot of deaths and move-outs, which you'll see on the next report. And then, of course, Ascent has made its appearance on the list, and it is in lease-up, so those numbers will steadily increase. I put the down units, 3 with a star. Those are the 3 units that were affected by the fire last week. They are not, they have not been deemed down units by code enforcement, but we're counting them as down units for the purpose of this report. We are working on marketing efforts for Aspen Meadows Senior. I did send Molly one of the flyers. We can pull it up if you want to see it. And I also made a similar flyer for Village on Main because we have 5 vacants there and then 5 at Aspen Meadows Senior. It reads 6, but we have a scheduled move out. So, and then we just had a death. So I anticipate that will go up, unfortunately. And then Spring Creek and Fall River, we've got some vacants that we're working through. One of them is a project-based voucher that the voucher team is working on finding an applicant for. 2 vacants at the Hearthstone. One is a transfer that will be done through reasonable accommodation, and then their unit will take place as a vacant unit. Those we tend to fill pretty quickly because of the 30% towards your rent requirement there. VOM, we have all 5 units are tax credit, so we're working through those wait lists. Those units, I think we have a smorgasbord of AMIs for those. Yeah, we've got 50s, 60s, and 130. So we might have an applicant for the 30%, but we've got some paperwork to work through on that one. And then the 50s and 60s, we're just looking for those folks who can afford those high tax credit rents, unfortunately. If we're not having any luck, we'll look at discounting the rents on those units, which we've had to do in the past. So we'll see how that works out. Can you pull up the flyer that I sent you in the chat? And then I have our vacancy loss down at the bottom. We're sitting at 37,843. I chose not to add Ascent in here because that will add $100,000. It's not a true picture of what's happening with that. So that's kind of what's happening. Briarwood, we're holding our vacant unit there pending the outcome of our discussions for potential sale in the future, depending on what requirements would be for the tenant selection plan. We don't want to fill that unit and then have that tenant not meet those requirements should we move forward with a transfer of ownership. The next report is the move-out report. I
have a question. Under the non-revenue units, and I know that those are units that property managers either live in now or used to live in. Are we still offering that to property managers, or what are we doing with those?
So currently the way, and I have this as an item that I want to talk to Kendra about, Hearthstone we cannot rent out. We also cannot, the property manager has to live on site for that one, and our property manager does not live even in Longmont, nor does she want to live in this unit, so that one just gets held. It's not rent generating, so it doesn't count against us, and that's a requirement from HUD. We had to get a waiver for the lodge to rent out that manager's unit because we have one manager for both properties. For the suites, we do have an employee living in the suites. And then Village on Main, we have a manager's unit that is vacant. I do plan on talking to our team internally about if that is an option, if somebody wanted to live there that was a property manager or a maintenance person. But right now, it seems like it's supposed to be the person who actually manages that property. Other places don't have that requirement. They're able to rent out. They actually stagger them on purpose so that you're not living at the property that you work at, but there's still a property manager there after hours. So I do plan on talking about that with our team to see if we can, if that's a requirement by IRS, is it a requirement by CHAFA, or is it a requirement by our investor lenders? And if it's not any of those, then is that an option for someone who works with us, who wants to live there? So we'll be checking into that. But yeah, those units don't count against us though financially, because they're not even factored into the rent generation. And in fact, we might need to rent the one at Village on Main, because according to CHAFA, if you're not renting it out to a manager, you're supposed to convert it to a LIHTC unit and get someone in the unit. So we'll be looking into that. The next report is the move-out report. This is for just the month of January. So we had relocating and deceased. We've had a couple more people who have passed this month or we suspect might pass. We're having hospice services, which is really sad. And then the next report is our move-outs for the entire year of 2025. And it's by reason and then by property. So take a look, we had 84 move-outs in 2025. It's a lot of turnover. We will be instructing staff not to use the not applicable reason. Like, we need to know, even if you're making a guess at the reason, at least make an effort to ask so we can track that data, because it's useful for us to know. But we had 14 people pass away, 9 evictions, 4 moving in with family, 5 moving out of state, 6 due to criminal activity. That probably gets lumped in with eviction, or maybe that's they leave before we get to eviction. 7 not applicable, 1 needing more space, 1 out of business. Reasonable accommodations, those are usually transfers from one property to another, or one unit to another within a property. 21 of just relocating, 6 rent too high, and then we have the unit transfers. Might be duplicate information with reasonable accommodation.
So how does 84 compare to previous years? Do you have that data?
I don't know that we have the data. It wouldn't be accurate. So now that we're tracking it last year and this year, as we go forward, we'll be able to compare year over year and see what's happening. But you can see the majority of our move-outs are senior properties, have a high utilization in the suites and such.
Do you have a value add to that number, like each move out in terms of staff time or down? Like how much is each move out costing?
We don't track that yet. We're trying to. That's part of that process improvement that Molly was talking about earlier in using Yardi to track staff time and unit turn time and downtime. We're trying to tighten that up and get more consistent, because some people don't enter it in timely, and so it's skewing our data. We don't track staff costs in time in Yardi right now, so we need to figure out how we're going to do that going forward for even just work orders, unit turns, things like that. So that is something that we'll be looking at, especially with the mobile maintenance, bringing it all into Yardi full picture. So hopefully in 2026 we'll start collecting that data. But yeah, I don't have anything to add to it.
Just from a gut feel though, does it feel normal, 84, high, low?
It feels normal for me in the last 2 years, between people passing, unfortunately, us being more strict on evictions and non-payment of rent coming out of COVID, because for years people weren't getting evicted. And so I think that it feels normal for me now. Probably would feel abnormal if you compared to 2020 and 2021 and 2022. It probably would look like we were doing a lot more evictions. But I think people are they're being hit hard by inflation and rising costs, and they're not keeping up with that, especially because we serve mostly senior populations.
What does out of business mean?
That, I do not know. I don't know what that one, I thought maybe it was the
I saw
VOM.
that too. I was like,
Like,
what's
my
that?
category.
I'm done.
Check it out.
Retired. I don't know if that was
Yeah.
tied
It's like
to
6, 7.
like VOM going from Village Place to Village on Main, but I'll have to ask. But yeah, that one's weird. We should probably remove that one.
I kind of like it though, it's
Yeah.
fun.
So yeah,
It really doesn't mean anything,
yeah.
it's fun.
And then as far as property updates, do you have
Well,
questions?
just going back there, just the one that's really concerning is that at Aspen Meadow senior apartments, we've only had 7 move-outs, but yet they're like one of the largest ones on our vacancy rate. So it's just that's one you just can't rent. And
So, did anyone see the Denver Post article about affordable housing having a 10% vacancy?
Yes.
Highest in a decade.
Yeah.
Okay, yeah.
We're still averaging 95 across all properties, not including Ascent, because that's in its own bucket right now. So I think we're still doing better than that. But when you do look at Aspen, what is the Aspen's specific vacancy right now?
So it's 90.
90.
Yeah.
So that's
is that-
10%.
Is that because there's too many people
So,
that can't even make affordable housing?
I mean, I think it could be a number of factors, but one major factor across the entire Front Range is we were so behind on production, and we had a good influx in the last couple of years, and we're waiting for, it's like you gotta let the dust settle. What we expect to happen here is we've had a ton of multifamily supply come on board, and those are still getting stabilized. And then based on the numbers that we have, what should happen is we stabilize, and then eventually things start getting tight again, and demand gets tight unless we keep up with production. So that is what the data tells us should happen in economics, but we're in the thick of it right now, and we got to see what happens.
So do we track, or have we thought about tracking why people are being rejected?
We do, and it's mostly they don't meet the 50% AMI, they're below. They need a 30% unit or a 40% unit, but we don't have those available. They don't even meet the 50%, they don't make enough money. And there are people who they come in and they're like, well, I can get $200 a month for my kids, and it's risky if they're within 10% of the 2 times rent requirement. I will usually approve that. I don't like doing it because they are severely cost burdened. So half of their pay goes to their rent, and that doesn't leave much for anything else. Now, if they've got a ton of money in savings, if they've got money in a CD that they can draw on, great. But then, as they draw on that money, they run the risk of being over income. Which once you move in, it's great. You're fine. You're set. You don't have to worry about that. But for people who have been drawing on cash, like I've had to turn people away because they were over income, because if you averaged out what they've been pulling out of their CDs or their savings, they actually get over 50%, and now we can't qualify them.
So in terms of this article, what is I haven't seen the article, what's the conclusion that they came to as to why?
I don't think there's really a conclusion there. It's more highlighting what they're seeing right now. But it could be a number of factors. It could be like what we're seeing on the senior side. It could be related to supply. It could be all of the above. They're still trying to kind of
I think there's a couple things.
Figure it out.
And longer term market things to look at that you just don't know, is that
Mhm.
our state population has continued to decrease instead,
Yeah.
it's not decreasing, but we're not adding population, we've got more net migration than in. I think that communities like ours that have a heavy immigrant population, I think you're seeing decreases in that for sure. I've noticed it in my own tenant pool, where some tenants who are long-term tenants have chosen to repatriate to wherever their home country is. I've had 2 of those in the last 6 months. So you're seeing that population declining. I think you're also seeing that now the affordable space is competing with the private market. As they're leasing out, they're offering up to like 6 months of incentives, and so why not move into a brand new amenity like with a pool and a workout center and a dog park for the same price? Now those will come to an end, but I also think for me as a landlord, I'm much more risk averse now too. So when you are looking at that and they are super close to the line, I'm likely to say no because they're so hard to evict. if they actually don't. As they tighten up the eviction rules and makes it harder and harder and harder, I'm less and less likely to take a chance on that.
So that makes sense. Kind of where I look at this is the thought that is, what is the message we're getting here? Is it that we're overbuilding our space?
That's-
Because there's nothing underneath of us to fill.
Market rate.
So we've
Or
been
if we're too high,
behind
too high cost.
since 2008 on building. We've been not keeping up with demand since 2008. Some people are leaving because the housing prices are too high, partially because of that lack of supply. Does that mean now that if we are catching up, which I'm not saying definitively we are, but we are doing, on the city side, we do have a contract to refresh our housing needs assessment to try and catch up the data with what's happening closer to now. But maybe if our housing prices stabilize, does that mean people will want to move back to Colorado again? Very possibly. It could go a bunch of different ways. I think it's too soon to assign it to something specifically, but we've had an influx of supply. That's what we have needed for 20 years. So let's see what that does.
Will they be doing the comprehensive plan?
Not related to that. We're doing the housing needs assessment for a couple of reasons. We have to meet new state requirements. Also, our data now that we're looking at is from 2021. There's lots of change happening. I'd rather have it more up to date. So we're doing it for a couple of reasons, but it's not related to the comprehensive plan.
It seems like a paradox. It's like the articles say, it says there's more vacant units, but we don't have enough affordable units to meet the need. So
Well-
really what you need is 30 and 40% units.
That's what we
which
actually
you
need.
cannot.
That's the hardest thing to
And
build
big-
and produce.
bigger.
3 and
Yeah.
4 bedroom units.
Yeah.
We're-
Yes.
Bigger units.
Literally the
and lower
hardest
subsidy.
possible things to
Yeah, we're
develop.
building the wrong things.
Right.
Yeah.
But because of
We're seeing a
financing,
lot of, in construction, we're seeing a lot more 3-person units come on dock, not 4, but 2 and 3. But our market, we're not slowing down
Yeah.
in construction. The developers are still all along the front range.
That's the tough part. Like, you need 50 and 60 units to make a deal work, but then that's where the market
That's
is
not where-
saturated.
that's where
We
the-
need 30s and 40s, but that just takes straight up dollars.
Yeah.
It's crazy. So it's,
And it takes 3 to 5 years for a project to come online, so you're hedging your bets. Like, it
Yeah.
makes me nervous about the potential for a mixed income project for us, because it's like, okay, if we do it now, are we gonna hit at the right
Right now,
time?
if it hit right
it's
now, it would
attainable.
not be
It
the
would not
right
be
time.
good. But in 4 years?
in 4 years,
Could be.
could be.
Yeah.
It's
So
it's
that's
a
tough.
magic ball.
You know,
know.
it's been broken for like 20 years since I got it.
I wish I had one. I'd share mine with you if I had one. But I
If
don't.
mine gets repaired, I'll let you know. Yeah, I mean, it's a gamble, and unfortunately, like, we're not a private developer, we don't have that private cash. So,
That's who's moving and shaking right now.
yeah.
Yep.
Property updates.
Well, didn't we talk about cosigners at one point too?
Cosigners, we can do, guarantors, we can do. It just, you have to be really careful that you do not convey the idea that someone has property rights if they're co-signing and acting as a guarantor. I had to co-sign for my friend who moved here from Columbia and didn't have rental history or credit history. And they wanted to rent to him, but they were like, our landlord's not really comfortable with that. I was like, fine, I'll co-sign for the first 6 months. You can see that he's fine.
Yeah.
So we can do that under the LIHTC rules.
Okay.
We just have to make sure that, you know, this person isn't actually moving in,
Right.
because people get creative.
Gotcha.
So yeah, Spin Meadows, the only update is we've got marketing flyers that were sent out to our partner organizations, other housing authorities. They're up at the
That's
senior
it.
center. Same thing with Village on Main looks almost identical to this, just different units available, different rent amounts. So trying to appeal to like market rate look of the information without making it seem like it's all affordable, because that wasn't working. So now we're trying this approach with our marketing, especially with Ascent, because the majority of the units that we have left are more towards the market rate crowd anyway. The suites, we have our HVAC systems upgrade project approved, and we're just working through selecting a vendor. Ascent, we have the lease up happening. We're getting units filled with the help of our communications team here at City of Longmont and also with Penrose. And they're working very closely together on the grand opening, which is scheduled for March 3rd at 2 p.m. You'll see invitations coming soon. You heard about our fire on February 3rd on the 3rd floor. We have water damage throughout all the units, smoke damage in the 3rd floor unit. The 3rd floor and 1st floor were project-based voucher units. So we are currently working with the family who was directly affected to move them to another unit, and they would like to stay on the 3rd floor. So thankfully we wrote our HAP contract so that the entire project, we can move them around without being restricted by building, which is something we have at Aspen Meadows neighborhood. The 1st floor unit, which was also a project-based voucher, we were able to move that PBV to another 1st floor unit because the family that was designated to move in there was moving in based on reasonable accommodation for a specific 3-bedroom 1st floor unit. So their move-in at the end of the month will not be affected by this. And so we'll just have the 3 units continue to be vacant during repair, and we'll collect the lost revenue through the insurance.
Are you gonna be able to collect lost revenue since they were rented?
I think so, because they would be rented if they were selected for renters.
Sometimes they get a push on that, but.
We'll fight as best we can to get what we can. And then we'll be using Danude Construction, the general contractor, to do the remediation because it just makes the most sense. We do have plenty of attic stock on site, so we shouldn't have any delays with getting materials. So hopefully we'll get those units turned around really quickly.
So I know you said that these sprinklers pretty well put the fire out, correct? Was the fire department called at all?
Oh yeah.
Oh, yeah.
Once the sprinklers go off, it rolls to the fire department.
And the fire department's literally right there.
Yeah.
So.
That's right.
Yeah, that's like across the street.
Yeah,
Right
that's true,
across
it's
the
right,
street.
yeah, it's right there on 17.
That's
So they didn't shoot water at it, did they? Okay.
I think it was pretty much smoldering when they got there. Yeah. And we do have fire stops above the range in every single one of these units. Lesson learned, they did deploy, but there was so much material on fire that it couldn't overcome that much fuel. So, but we did see they deployed, but they also melted. So if you're cooking and there's a little grease fire, it'll work well for that. But if you've got a bunch of stuff in boxes, and it was a laptop bag, which is like plastic, so it just
Nylon.
burned
Flammable.
and burned and burned. So unfortunately,
Is there any residual smell in the building?
in the unit.
Just in the unit,
I don't think.
okay.
I think the smell is pretty much dissipated from the hallway. The other units, they're so tight, those building envelopes and those units, you couldn't smell much in the unit next door.
Okay.
So I did tell them throw in an ozone machine just to be safe, clear the air. But we couldn't leave it open because it's winter. So, and then I, made sure that the heat was on and everything. They are working on. They have their electrician there today to work on the electrical panel. So they're investigating because that's not working now, and they think it's just the panel. So they're working on that, and then once we get that report today, we're going to start with the insurance. So start getting it fixed. And that's kind of what's going on with properties. As far as LHA generally, we have a vacancy with our maintenance supervisor. Molly and I have been working on getting that position posted. I wasn't in a hurry to post it just because we had so many other things kind of happening all at once. Quincy, our regional property manager, is returning next week from his mini paternity leave, and then he will be here for like a month and a half, and then he'll go on a longer leave.
Yeah.
She's a little girl. So she made a little surprise. She came a day before she was scheduled to. She's adorable, and everybody's doing fine. And then we are still hiring for a community manager at Aspen Meadows Senior and Neighborhood. So we have some candidates that we're just waiting on final selection, but everybody has been sick. I don't know if you guys have experienced that, but there's some nasty stuff going around. So hope to have a selection this week or early next week.
Great.
Question. The suite, not the suites, parts stuff. They're still having a problem with water.
They are still having the problem with water. It is a very strange situation that some people don't get hot water, but then when our staff go, there's hot water. But they have also seen where the hot water is not making it to them, it's being affected by washing machines, the laundry rooms, so they cut off hot water to the laundry room. Some people are still having issues. We had a plumbing company come on Thursday last week, and they couldn't find anything definitive and obvious, so they're gonna do some testing and see if they can figure out what's causing it, and so there's more to come. But yeah, we are still having some issues.
How long has this been going on?
Years, according to the
So,
tenants.
it sounds to me like a design problem.
That's what it seems like, but I kind of want to go take a look at it myself because I'm a visual person. So hopefully when they come to do the testing, the next round with this plumber, they're gonna reach out to the company that installed the systems to see if they can get any insight from them. Yeah, it's weird.
Have you thought about having the tenants, so I've done this before, you give them a thermometer thing, and when they're having, that they film them putting the water, the temperature thing in the stream, and then filming the actual temperature to verify that it's actually happening in maybe one, like date stamp that?
I don't know if our tenants would be able to do that.
That's unfortunate, because it really gives you a lot of valuable, like, what time of day is this happening, and is it really happening?
Well, we thought it was happening when people were doing their laundry, so we limited hours to do laundry and didn't see a change. And then we've cut off the hot water to the laundry and still have not seen a change. But when our staff are on site and someone calls and says, I don't have hot water, and they go in, it's at 120 degrees when they test it.
Yeah, it's tough.
So it's really hard to say. I don't think that they're lying. I think they're experiencing no hot water. And even if it's taking, it shouldn't take 45 minutes for hot water.
Isn't it one section of the building?
It's just one wing, right? Yeah. I want to say the first floor. So it's really not having a plumber on staff.
Yeah, you don't think the tenants there could gather that data for you?
Maybe a couple of them, possibly. So I don't know how many of those thermometers we have, but we'll have to get some and see. Maybe we'll try that and see if they can do it.
Okay. Anything else? All right. Sarah.
Quick, Suites, 24 calls for service in the last month. We had 2 reports there. Everything else was within 1 or 2 calls, some welfare checks, some random, like an animal was injured. Nothing crazy, so that's good. Still working through our meth detectors, and my office is still filled with them until we get them all installed. Right now we're not seeing them on the portal, except maybe 5 or 6 that we've installed, so not sure why that's happening, but working with our vendor is, he's very responsive. And I think, he's an in-between between their IT team or the folks that are actually working on the portal itself, so some lag time.
Sorry.
That's a nice song.
It's a great ringtone.
So that's all I have. Nothing else to report. Just working through the fire last week with Summer and Lauren and fire department. And the S&J is a safety and justice building.
I thought so, but I didn't want to assume.
But I'm gonna get that report for you, Lauren.
Thank you.
Any questions for me?
Probably, but I can't think of them. Okay, Molly, is there anything update from the executive director?
I'm going to say no. Not today.
Okay. Anybody, board, have any questions or comments or whatever? Nope. Okay. Motion to adjourn.
To adjourn.
I'll second.
Okay, we are done.